Then another common case we are getting in the OPDs is cellulitis. Cellulitis is an infection of subcutaneous tissue. In the next stage is erysipelas. It's a secondary infection. It may the infectious agent can enter in the body through a wound or a small abrasion. It is dermal. Cellulitis is subcutaneous. Erysipelas is dermal infection. This erythema, heat, swelling, pain, and tenderness. You can see the patient tell doctor yesterday I don't have any problem, but in the night I feel some chill. I have some fever. The morning my leg or hand anywhere in the body it can happen. So the area becomes so redness and so swollen and very hard, very heat to touch. Lymphadenopathy also you can see. In the case of erysipelas, you can see the demarcated raised edges. And in the case of cellulitis, second picture is cellulitis, first picture is erysipelas. That is, you can see the bullets and some margin. But in the case of cellulitis, it's a no raise, nothing, only a red patch you can see. Okay. As always, we have to give importance for the face cellulitis because this face cellulitis can cause an eye infections very fastly. Okay. It's because of streptococci or staphylococci infections. Erysipelas. You can see the margin. Complications. Once the cellulitis happens, again a chance of the recurrence of it. Okay. Sometimes subcutaneous abscess formation, septicemia, and atlas nephritis also can cause. So if the patient is coming with you in the amavastha, in the first stage of cellulitis, you can treat. First stage of erysipelas, you can treat. But he is coming with a secondary stage, the fast spreading stage, you should refer because the systemic antibiotics is needed because it's spreading very fastly and cause some systemic infections and septicemia. So better to refer. So the symptoms that shows that the cellulitis is spreading, shaking, chills, feeling ill, fatigue, dizziness, lightheadedness, muscle aches, warm skin, and sweating. And drowsiness, lethargy, blisters, and red streaks. So in this condition, if a patient is coming with a cellulitis, you can correlate the cellulitis with the Vrana Shodha. Both Pitta, Rekta is involved. Here also the Pitta, Rekta Hara line of treatment you have to adopt. Same Visarpa Hara line of treatment. In the Amavastha, patient is coming with mild pain, mild rise in temperature, mild immovable swelling. This you can treat at that time. You can give Nimbadi Kashayam there. You can give Pajaramadam Kashayam there. You can give Panchadiktam Kashayam on the first stage. Added with Gugulu Panchavala Churnam, Sudarshana Churnam, or Sudarshana tablet, or Gobi Chandranadi Gulika, you can treat. Externally, Jadamayadi Churnam, you have to boil in milk, make it cool, and apply over the particular area. It reduces swelling. It reduces redness. Okay. And you can apply Paradhyadikeram in that. The only thaila which is indicated in cellulitis, that is Paradhyadikera. Paradhyadikeram, which is explained in Mandali Visha Prakaranam in the non-healing ulcers because of the Mandali Visha, viper bite ulcers. So the only thaila which is indicated in the application of cellulitis, that is Paradhyadikeram. You can apply on the Amavastha. Okay. And Pachimanavastha, the secondary stage. Second stage is spreading very fastly because it's having cutting pain, burning pain, locally red, and very hot in touch. You should refer it. Okay. You can give any Pitta Hara line of treatment. Nalpamaradik Shalanam, Shira Kashaya Shalanam. If more pain, Karaskara added with the Shiri Vriksha, that Hara you can start. And Pakvavastha. At that stage also we can manage, same Pitta Rekta Hara line of treatment you can adopt. Same line of treatment. Puluchadi Kashayam, Nirgutyadi Kashayam, Rajavrikshadi Kashayam, Vishajvara. It's very, very fast Pitta Hara in nature. And Krimikhana Vadiga, Vilvadi Gulika, Avipatti Churna for the Nitivirejanam, Shigru Purannavadi Churnam. Shigru Purannavadi Churnam, it is told in the Kida Visha Prakaranam. Shigru, Punarnava, Manyal, that is Haridra, Vayamba, that is Vaja, Chandana, Padha, Ishwaramuli. So all these things make it the churna, the chandanam, ishti, shirisha, and gokshura. These things you can make. That's a powder. That also you can mix. You can make a paste and you can apply over the pakvavastha. Okay, and parandyadikaram anytime you can apply. So the main line of treatment we have to adopt is Pitta Rakta, and especially the Trishna Prakarana, the Chilsas, which is explained, is very beneficial. So Chukka, Tuva, Pappada, Musta. Chukka, I think non-Malayalis will be there. So Chukka, that is Shundi. Tuva, that is Dusparsha. Parpadaga, Musta. Tulir, that is Chandana. Chunda, that is Brihati. Chinna, that's Chittamrata, that's Guluji. Kottambali, that's Dhanika, Vacha, Patola. These things in equal parts, make a kashaya and you give. Okay, Kutikvadam Vendupipe, Sitadhyam. So you have to add Sita. So in that kashaya, you add Sita. Okay, Trishnana, Munche. It reduces the Trishna. And any Tivra Roga, you can, any Pittarekta, Adhikya Roga, you can give this. Shundi, Duspasha, Parpada, Musta, Chandana, Prihati, Guduji, Dhanika, Vacha, Patona. Okay. And Visarpa Chigilsa, you have to adopt. Any of the impetigo, in the case of erysipelas, in the case of cellulitis, you have go for the main thing you have to focus on Visarpa. Vividham sarpadi yado visarpastena sasvada. This disease which spreads anywhere in the body. Parisarpana, which having the sarpana subhava. That's a visarpa. Tridoshajam, didoshajam, egadoshajam. Egadoshajam sadhyam. Didoshajam ubadravarehidam sadhyam. Tridoshajam asadhyam. So always egadoshaja visarpa may not be seen. Always didoshaja or tridoshaja is we are getting. We know the ahara viharas. Lavana Amla Katu, Ushna, all Paitiga Pittarekta, Aharas, Pitta Viharas can that retain the Pittarekta and cause the disease. The doshas, Tridosha Pragopana can cause Visarpa. Abhyandra Visarpa, Bahir Visarpa is there. Bahir Visarpa is Sathya, Abhyandra is difficult to treat. In Abhyandra Visarpa, it's still that Marmobagada happens. So Asadhya. This is Pitta Dushti Vigaras, Pitta Visheshan, Rekta Visheshan causes this one. Associate with the Jwara, Krishna, Morsha, Moha, Chardi, all the spreading lakshanas, whatever we are telling in the impetigo and in the case of erysipelas or in the case of cellulitis, we can see the Paitiga lakshanas. Okay. And that's the Kabhaja Visarpa. Same thing, any Kabha increasing conditions can cause this one. Sannivada Visarpam Achikilsadam. Same thing. Only that this is only the shlokas, no problem. And the treatment. Lenghana Ullekane Shaste Tiktakanam Sevanam Kapastana Gede Same Rukshe Praleve. That's why we should go for the Lenghana Chikilsa. We should go for the Ullekana. We have to go for the Vamana. Tiktakanam Sevanam. When Kapastana Gede Same, if the doshas are in the Kapastana, you know, the Kapha always treated with the Vamanam. That's why. Ullekhanam is telling, Vamanam is telling, Tiktarasa is very good rasa to treat the kapha. That's why Tiktarasa, kapha pitta can be treated with the Tiktarasa. Pitta sthanagade, what we have to do? Shonidasya vasekam virejanam. We have to go for Shonida, that's a Rekta Mokshana and Virejana. Okay, Marudashayam. If the Maruda, we are going for the Snehana Karma. But in the case of this Visarpa, we have to understand that always the Kleda Bahulada will be there. Always the Dosha Dushti will be more. So more Snehanam is not indicated in the case of Vadika Visarpas. So kashayas you can use in the case of kaphapittaja, the spreading natures of Visarpa, that is Musta Nimba Patola Kashayam, Chandana Nilkamala. These are Charaka Chilsa distilling. Ananda Ushira Amalaki Musta Kashayam is also indicate. Another yogas in the Sharaka it is explaining, and we can use in the case of practices as Kirada Diktadikwadam, Praponderikadikwadam, Drakshadi Shidakashayam, Patoladi Shidakashayam, and Drakshadi. So other common kashaya chuna what we are getting in the market also you can use, but in that when you are using this shita kashayas draksha, draksha diguna bhagam is more good, so you have to add one more part of draksha into that. Soak the draksha or 15 to 20 drakshas in the overnight, and next day keep that while boiling the drakshadi kwada churnam and make kashaya. That will be more beneficial than the normal drakshadi kashayam. And the Koshtagada, you have to go for Virechana. Nishotara churnam, that is Tribhritadi churnam, Avipatti churnam you can use. Trayamana churnam, Asikshira pagam for the Antarvidrati. Tribhalakwatham for the Rechana added with the Nishotara churnam. That's added with the Tribhat churnam. Amalaki swarasam added with the Krita or Sita you can use. See, all these are pradehas. You can see that's in Charaka Chikilsa, Visarpa Chikilsa Adhyayam. Better to avoid all the pradehas or the lepas in the first stage. You can do the lepas, the yoga. This is told for lepana for the kshalana purpose, for the dhara purpose. So whenever the doshas reach into toksthanam, then only go for the lepanas. I think Madhu sir has taken that class. So after Deepana Pachana, after the Shodhana, when the doshas are tokstam, then only go for the lepanas. So the first stage, if the bullas, we are don't want to break the bullas, don't go for any sort of lepanas. Just do the kshalana, just do the hara. Okay. So with Pitta Visarpa Chikilsa, you can adopt Trayantyadi Kashayam, Tribhala Gugulu in Prana Chikilsa, Gobi Chandranadi, any infection stage, Sudarshanam, Avipatti Churnam, Aragudarishtam, Shirisharishtam is told in Vishopatravam, in Paishaja Ratnavali you can see. Guruji Sattvam is a very good Pittahara, very good Daha Shamana in nature. That's I told warm floor paste to burst the bullas. After that, Madhura Gana drugs, the ghee made from that, we can for the external hara or application. Shiri Vrikshatok Kashaya also can be used for the thara. Karanja Patra Thara is very good wound healer. And Vrana Shodhana, Vrana Robana, Karanja Patram. If it is Karanja Patram is not available as a fresh for you, make a this one, make a paste of it, make a varti from that, and you can keep as such. It may months, 1 month, 1.5 months you can use. And make a swarasa and just make a paga and make it as a vakti, and you can use. And for dressing the wound, you can use that. And Guluchadi Kashayadhara, Pranashodhana, Ropana, Dahahara. And another one, Gairika, Haritagi, Yeshti, Karaskaratwak. Say make a kashaya, it relieves the pain, it relieves the swelling, it relieves the redness, and also it reduces the hurt in a particular area. Okay, you can use that hara. And it's also good for the Vrana Shodhana Ropana in nature. And for a follow-up, you can give Jivandyadi Kashayam. It's available in market. Gopi Chandradi Gudika and Guluji Churna or Guluji Sattva is available, and Avipatti for the Nitya Virechana purpose. Okay.